Thank you, Mr. Chair. I just want to bring back the faces of some of the people that are impacted by the lack of sufficient staffing in rehab facilities, long-term care facilities, nursing home facilities, and we've got to do something about it, not 10 years from now, because people are dying. You've heard story after story after story of Medicaid recipients here who want to care for family members at home and are struggling to do that. And again, I remind you, the exploding cost of Medicaid is because of long-term care and seniors who are going to end up in long-term care or rehab, or the disabled who are in these facilities. But this is what happens when you don't have sufficient staffing. Eddie Bernice Johnson, who was a member of the Science Committee last year, I was so proud to sit across from a portrait of her as the first Black woman to chair that committee, did not die because she had spinal surgery. She died because she sat in her own urine for God knows how long, got an infection, and the infection killed her. In my district, there is a rehab facility that's been in the news lately over issues like inadequate staffing leading to inadequate wound care. And it's not just nurses. It's the people who work there overnight and help care for the folks. And one woman, Cindy Wilson, a constituent of mine who's a caregiver for a veteran named John Hill, says she came to the facility and had concerns about her loved one. Quote, he was crying, he was upset, he wanted to get out of there so bad. I wanted the same for him because of the lack of care. Inspectors found that for multiple reasons, staff failed to maintain the call light in a position where residents could access it. And so many times when residents press the call light, nobody's there to come because they're understaffed and in other areas and can't get through them. So when my father, who after a bleeding metastatic brain tumor was in a rehab facility, I saw his mental health decline because of how often he is in his bed pressing the call button, waiting for somebody to take him to the bathroom, brush his teeth, do any of the things he was used to doing on his own. I watched the same happen to my mother when she had to go in memory care. We can keep kicking the can down the road all we want, but this is going to explode as a problem in our Medicaid, in our Medicare, and our private insurance, although most of these folks can be covered by Medicaid or Medicare, if we don't do something about it now. And if the problem is there's not enough people to fill these positions, let's address that. This bill does nothing to do that. Let's address the fact that many of these people who are caregivers in their own right don't make enough money to pay their own bills or take care of their own family. Maybe we need to do something about that. Maybe we need to incentivize worker pipeline programs to get more people in these jobs. Again, not just nurses, but the care partners and the people who are there overnight helping take people out of their own urine and feces. That's all we're asking for here. That is all we are asking for here. And if this bill doesn't do anything about it, we better not kick the can down the road 10 years, because there will be a lot more Eddie Bernice Johnsons who we are mourning the indignity of how such a dignified woman left this earth. I yield back.